Welcome to another forum by Livable Community Policy Board at the county. I'm Tracy Achenbach. I work for the East Central Iowa Council of Governments, but I'm also the chair of the Housing Action Team. And it's been our group that's been working on providing these educational forums every month for the last 6 months. You are at our last one, so you are special guests today. I would like to say, first of all, thanks to the Iowa City Area Association of Realtors for providing us the space for all of these months. That's been a wonderful asset for us to be able to use. I also want to thank the City Channel for always taping our events, because that has been very much appreciated. And I also want to thank today's sponsor for the event is Midwest One. And so hopefully all of you have signed or put your name on a little drawing, because we will have a drawing at the end of the day, and today's prize is cash. So that's a pretty good thing. So, and we have fewer people here today, so you have a better chance of winning today. So that's a good thing. One last thing that I want to mention, because I actually rode this to and from work on Monday, is the 380 Express bus. If you haven't seen about this or tried it, I would suggest you do it. I absolutely loved it. Rode it from downtown Iowa City to downtown Cedar Rapids. I happen to walk to and from both bus stops because I like to walk, but I could have taken buses to and from if I had chosen to do so to where I had left from. But anyway, I just encourage you. I left some brochures back on the back table. They have times on them, the fares on them. It's a great way to be able to travel. Yesterday, I white-knuckled it on 380 with the pouring down rain, and I was going to work in the dark. And on Monday, I did not have to do that. I could sit back and let the driver do it, so it was pretty nice. So today, we have Pat Hayden, who is helping us with this forum, and she is actually going to conduct it and introduce our speaker. So I'm going to turn everything over to Pat at this time.
Thank you. And I am Pat Hayden, and I'm a member of the Housing Action Team of the Johnson County Livable Communities. And I want to do a big shout out to Tracy. She's been our fearless leader for the last year. And as she mentioned, she's located in Cedar Rapids now, but she's just done a wonderful job of leading this team. So again, thanks so much. And yes. And this is our final forum, as she mentioned. We've just had great attendance throughout the year, starting with the first forum in May, and this too will be another very informative one. Let's see. Well, turn it on. This actually is Jeff Kalbach's slide. He is the Johnson County Aging Specialist, and instead of taking that out, I thought I would leave that there. He's been in this position for less than a year and has already contributed so much. So his information is here. You can go on the Johnson County Livable Communities and see his phone number and how to contact him with any questions you may have about aging and livable community in Johnson County. And the forums are a collaboration between the Johnson County Livable Community, the Greater Iowa City Area Home Builders Association, and the Iowa City Area Association of Realtors. A big thank you to each of you for your work in the cause of the elderly. And just a few words about the Housing Action Team. We recognize that housing options are key components of a livable community. And this action team has focused on affordability, accessibility, universal design, home safety, availability, and housing options. And here's a picture of all of us. And if you are here today, if you wouldn't mind standing up and being acknowledged and recognized, I know, yes. So thank you. Thank you for your work. Yes. Today's forum is titled Your New Home, Levels of Care in the Community, and I am delighted to introduce Kim Birken-Jackson as our guest speaker. She has spent her entire professional career in the cause of the elderly, working as a CNA, LPN, and RN in long-term care. And she also has her PhD in nursing, and she is currently the administrator at Oak Knoll Retirement Residence. She has lots of credentials behind her name, and I'll have her briefly talk about some of those credentials, pretty impressive. But most important to me today is that I had the opportunity to work with Kim for many, many years at Oak Knoll. And, it was one of those professional relationships that it just clicked every day in giving the residents of Oak Knoll the highest quality of living imaginable. And it was because of her care and passion and that she brought every day to Oak Knoll that really makes her an outstanding advocate for the elders in our community, and she is passionate about everything she does and says. So it's with my pleasure that I introduce to you Kim Birken-Jackson.
Hi, everybody. I'm very pleased to be here. And I got lunch, and there's a door prize. So all things considered, this is a super win for me. I don't usually talk from slides, so I might stray from the path intended, but we'll see what I can do. So as Pat said, I'm currently the administrator at Oak Knoll Retirement Residence. I've worked at Oak Knoll 3 times. Every time I went back to school, I had to leave periodically. But over time, it's been about 18 years. I'm also an adjunct professor at the College of Nursing in the School of Social Work. I'm a litigative expert for the United States Department of Justice, and I'm an expert on cases they're working on. An independent consultant for long-term care, and I recently appointed board member to Trail of Johnson County, which I haven't had my orientation yet, so don't ask me a lot of questions, but I'm very excited about it. So they asked me to talk about living options in the community. So I've put together some information about aging in place, short-term care versus long-term care, which would be nursing home care, and life plan communities, of which Oak Knoll is one. Talk about the differences of all those things because they can be kind of confusing, and then leave you time so I can answer your questions. For aging in place services, I was trying to think of examples that would help you stay in your home longer. And I'm a nurse, so of course I thought of visiting nurse first. Home care services, which either can be medical or non-medical home care services. Meals on Wheels, and Trail of Johnson County. Sort of seems like a case management business to me. But then I was thinking on my way over here, also occupational and physical therapy can help you adapt your house so they can make your house more ADA accessible for you as you age with your specific changes. So there's a lot of creativity that can be involved in helping you stay in place. But if you do decide to move to assisted living, that's the next level in the hierarchy of care. So assisted living is not a nursing home and it's not independent living. It's somewhere in between where there are staff available 24 hours a day. They may not always be a registered nurse. There might be certified nursing assistants or med techs, but there's always somebody around in case you need something. There are private pay assisted livings, Medicaid, and then regular and memory care. So when you see something advertised on TV that says independent living, assisted living, and memory care, that is not a life plan community. That doesn't include the nursing home section. That's really an important distinction I wanted to make, because if you don't meet the state regulated criteria for assisted living, you'll have to move again. So I just want you to keep that in mind. And then nursing homes, there are a number of nursing homes in Johnson County. They provide skilled care or intermediate care, and I'll get into the difference in a minute of that. Memory care, some are private pay, some are Medicaid. Medicare is involved when you're doing a recuperation type thing or therapy, so following a hip replacement or something like that. So that's usually, Medicare is short term, and then the VA can cover some benefits. Also, long-term care insurance will cover some things. And then hospice is not a level of care. It is care that can be provided at any of those previous levels of care, but it is a Medicare benefit and everyone's eligible for that. And there's a misnomer that you have to be within 6 months of dying. You can graduate from hospice and you can get an extension from hospice with no penalty. And I would say people are referred late in the process for hospice, and palliative care and end-of-life care could go on longer if the referrals were made sooner. So there's no penalty if you graduate. Life plan communities used to be called continuing care retirement communities. That's what Oak Knoll is. Oak Knoll provides independent living, assisted living, both regular and memory care, and then nursing home care, which we call the health center, which is also regular chronic care and memory care. There is not another life plan community that I can think of in Iowa City, Johnson County. No. So home care agencies will provide services. So whatever you are willing to pay for, most home care agencies will provide in your home. The private pay, as I said, Medicare, Medicaid, your long-term care insurance, and veterans benefits may provide for some of those services. They may not provide for the cost of all of those services, and it's very expensive the more hours you add on. They can do non-medical things or chore services. They can act like a companion and go to doctor's appointments. They can be a scribe at the doctor's appointment to take notes so that you don't forget while you're talking to your doctor. Or they can be medical assistants, which is a CNA or an RN caseworker, case manager for that. It can be short-term if you're recovering from something, or it can be long-term. Considerations for home care, there has to be some considerable financial planning involved in that, because you're going to pay the agency, whoever's coordinating the home care, from $18 to $40 an hour, depending on the services that you need. You must make sure that you do some research and get a reputable company. You want somebody that has reliable staff, that does background checks, that does training, that will guarantee their shift coverage. Otherwise, you could find yourself in the middle of the night without shift coverage. And then provides for safety and security. So part of that is the background checks. They're not required in home care. I don't think everybody knows that. They're required in assisted living, and they're required in nursing homes, but they're not even required to be a certified nursing assistant to work in home care. They could just be a nursing assistant. So, yeah.
Kim, you said reputable company. Where would you go to check out reputation? Is that word of mouth? Or?
So for home care, unfortunately, it would be word of mouth. Yeah. Yelp, you have to look for reviews. Jeff could help with that. Mm-hmm. I'm pretty sure Jeff could help with that. Also, you want to look for longevity in the community. Is it I'm not really a chain type person, so you're going to look for somebody from the Iowa City, Cedar Rapids corridor, or wherever you are. See if you can, if they know the community that they're working within, and then you're just going to have to talk to each other. Assisted livings are kind of the same way. The nursing home compare really works for nursing homes, but it's really hard to navigate, I think, for the consumer. So word of mouth, I guess. The hospital discharge planners should be able to help with some of that as well, because they make the referrals when people go home from the hospitals.
Just offhand, I found that I attend the church regularly. And
oh, sure.
There's a lot of discussion.
Mm-hmm.
People have an impression about which ones are good and which ones are not.
Yeah, that's very good. I also find, weirdly enough, if you sneak on social media, people will put a lot of things on social media that you can see. So you can check that out. Thank you. Assisted living, as I said, provides some assistance with activities of daily living, but you really could be by yourself for 24 hours if you needed to be. You'd be safe, but it's not what you're looking for. So they are certified by the state. They're not licensed. They have a certification. They're either certified as a regular assisted living or they're certified as a memory care specific. This year they decided that they would put the certifications together, so you might have an assisted living that's blended with both, or it could be on different floors or different wings. You have to meet the state mandated criteria in order to live in assisted living, and the assisted livings are surveyed by the state every other year. So somebody comes in for one day and looks at everything and talks to the residents and talks to families to make sure that they're following the criteria. Some of the discharge criteria that places are required to follow is you can't need help from 2 people to transfer. You can't have unmanageable incontinence. So you can have accidents. If you can manage the accidents, it's not a big deal. If you need help with that, then you would receive notice that you need to move to a higher level of care. Is that clear? Again, private pay, Medicaid, long-term care insurance. Medicare does not cover, as I said. Medicare covers short-term, post-acute stays in nursing homes.
Is that still 90 days or 1 year?
It's 100 days, but you have to be making progress, so it's not a guaranteed 100 days. You have to be moving forward in your recovery.
So on the assisted living, it's meeting this minimum requirement of care, but you could need not hardly any care to live there. There's no upper.
Right, that's right. She's saying there's no upper limit. So you could need, so that's the all-inclusive or the fee-for-service part. So in most assisted livings, it's a fee-for-service. So you could purchase whatever services you need: med assistance, help with dressing, showers, laundry, or you could need hardly anything and just want to be in assisted living. Mm-hmm. Yep. It's the other end, so that they're not certified as an assisted living and acting as a nursing home. So some considerations for assisted living: always looking at safety and security, staffing ratios, the type of contract, and whether or not they have CPR certified staff. That sounds ridiculous, but some places have decided if they're not going to have CPR certified staff around the clock, that they're just going to call 911. If you're not interested in that, if you want somebody to start CPR right away, then that needs to be a question that you're asking people. And are meals included, or can you cook in your apartment? So if meals are important to you and you want them included, you should ask about that. Nursing homes, of course, are licensed by the state, and they follow both state and federal regulations. I always like to put in a sentence that we meet and maintain over 500 regulations we have to keep track of. They must have a licensed administrator, and the administrator has to be full-time, 40 hours a week as the administrator. So if I was going to work as a nurse on the floor, I'd have to do that a different 8 hours. So, and they must have a director of nursing who's a registered nurse. Now, some of the more rural nursing homes in the country can ask for a waiver on that and have an LPN as their director of nursing with an RN consultant 4 hours a month. Skilled is the Medicare A I talked about. So skilled stays are for a hip replacement, for recovering from a heart attack, pneumonia, some sort of event where you had a 3-day qualifying stay in the hospital, and then you transition to a nursing home to get better and to go home. So those are, the skilled stay can be referred to as a short-term stay. It's the same thing. So you're just there temporarily until you get strong enough to go home. Memory care is for people living with dementia. And intermediate care or chronic care is the people who require assistance 24 hours a day, cannot live alone, and are living in a nursing home for the rest of their lives. Considerations for nursing home care. I've spent 30 years working in nursing homes, so my list is longer here, but you can look at the quality rating on Nursing Home Compare. That's Medicare.gov. It's a 5-star system. It's easy to find the stars. It's not so easy to understand how they get to that score. It's a weighted system. It's super complex. It's very governmenty, but it's a good place to start. You have to look at staffing ratios, and you should be able to ask people what their staffing ratios are. It's hard to believe, but there are no mandated staffing minimums in Iowa. So the rule is you have to have enough staff to provide substantial care for the residents. It's really a gray area, so staffing numbers in different places are vastly different. Staff are required to meet the needs of the residents. That's the regulation. Longevity of leadership. I have a bias there because I did my research for my PhD on leadership in long-term care. But there is evidence and research to show that the longer the leaders are in place, for instance, Pat was at Oak Knoll for just 36 years. And Steve is our new executive director, and he's been there 19, and I've been there 18. Longevity of leadership shows stability of an organization, and you're not going to get a quality product if you have frequent turnover. So I was asked to speak once in Indiana, and I spoke to a group of people who had 13 administrators and 15 directors of nursing in 3 years. That's what I said. How can you possibly implement a quality program if you don't even know everybody's name yet? So look, ask about longevity of leadership. Take a tour and look at the cleanliness of the property. Look at the environment. Look at the staff. Are the staff interacting with the residents? Do the residents look happy? Are there interactions between the staff and the residents? I don't know if I put this in my slide. You should be able to ask anybody for a tour. You might have to wait, but it shouldn't be an administrator giving you a tour. A CNA should be able to give you a tour. A rec aide should be able to give you a tour. Just whoever's available should be able to tell you what they're proud of in their community and show you around. They should be comfortable with that. If you have to make an appointment with somebody to come back later to see the place, that is a flag for me. That's a red flag. Anybody should be able to show you around. Life plan communities like Oak Knoll provide all levels of care. They may also provide additional services like adult daycare, home care, hospice. They could be life care or fee-for-service. So in life care, it's a financial arrangement between the resident and the company so that they pay the same amount no matter where they are in the continuum of care. So they don't see a huge increase when they move to the nursing home. It's a huge economic savings for them if they need the care. So it's sort of like a security in their back pocket. If they need care, they're not going to be devastated financially. Fee-for-service is a place where you'd go in and you'd pay a certain amount a month, and then if you needed some extra services, they would tack on the service. So it's exactly what it sounds like, fee-for-service. Some allow pets, most do not. And I think life plan communities provide opportunities to reduce social isolation because you become a community. It's sort of like a dorm, only way more dignified most of the time. So life plan communities, you have to think about the contract type. There are various contracts, how much you pay up front. Do you pay anything up front? How much the monthly fees are based on the size of the apartment that you buy. Cost, of course, for financial planning. Healthcare services, you want to talk about their healthcare services and what their quality expectations are. Are their staff CPR certified? They better be. They should be. You should have CPR certified staff in your building 24 hours a day. Lifestyle, if you're a quiet person who doesn't like groups and doesn't want to do activities and wants to stay by yourself, you may not consider a life plan community your ideal location. But if you're feeling lonely in your house, it's too big, and you feel like you could enjoy music or some programming, then this might be the perfect ticket for you. You want to look at the financial stability of the company. Safety and security is on every slide for me, and quality. There are lots of quality metrics out there, so you can look at the quality care people are provided, and anybody should be able to talk to you about that. Hospice, as I said, you all know, is a Medicare benefit. Everybody's eligible for hospice care. You get a qualifying statement from your physician who says that you will pass away in the next 6 months, but that is always constantly reevaluated while you're enrolled in hospice. And you can either graduate from the program without penalty, or you can have an extension if you still qualify. They provide assistance with personal care, so they have CNAs, they have nursing services, they have social workers and pastoral care. They do not provide 24-hour care, but Johnson County is lucky because we have the Birdhouse and the Mercy Hospice Unit, and they both provide short-term respite stays and longer-term stays for an additional cost. So I talked too fast, but I think planning ahead, adapting your home, interviewing service providers, you know, they're going to do a job for you when you're vulnerable and you need assistance, and you need the assistance to be consistent and reliable. You need to trust the people that you're talking to. Ask as many questions as you can think of. Ask your friends to think of questions. Consider case management. Before Iowa City, I lived in Seattle. We participated in a case management program, which worked really well if people's kids were not local. So we coordinated services for people and then figured out where they needed to be in the continuum. So it was sort of a one point of entry program. Financial planning will be key to pay for all of this because it's expensive. And talk to your kids and your doctor about what your expectations are, because the more frail you get, the more control the kids want to have over things, and they need to know what your wishes are so that they can follow your wishes. And that's where the advanced directives and the I-posts come in. So Honoring Your Wishes is a big program in Johnson County. We're very lucky that we have conversations about end of life and what people want and how they want to be treated and what services they are expecting to receive and not to receive. It's really important that your family know about those wishes so they don't mess it up in a crisis. So.
This has been great information, obviously, you know, and I imagine that there are going to be lots of questions because it's complicated also. But for those of us who have spent our lifetimes in working in communities for our elders, you know, we really talk about, we humanize or try to humanize it. And can you talk about how we provide purpose or define purpose for the residents that we serve? I think that that's really important to discuss also.
Thanks. I just recently started thinking about purpose when it comes to aging. And so we're looking at developing a healthcare system where the people who work in the system are working there with intention of caring for seniors and not just accidentally falling into that job. So you have to shift the stigma against aging. You have to shift the stigma away from poor quality care. And the only way we can do that is by improving the quality of care that's provided. And so you talk about why people want to work with aging persons. It's usually because somebody has impacted their life. For me, it was my grandmother. You talk about aligning their personal mission with your organization's mission, and a lot of places don't even talk about their mission, or it's so long that they can't remember what it is. So you have to make your mission statement learnable so that people can get behind your mission and line it up with their personal beliefs. And then you have to look at people differently when you're looking at their strengths. So I've talked to our residents at Oak Knoll about what gives you purpose at Oak Knoll, and they talked a lot about volunteering in the community, and they've had rich, wonderful lives, and they're able to share those lives with our staff and enrich the lives of our staff. You also have to talk about residents who are living with dementia. And it's really important. There's a lot of research out there that will show that residents who live with dementia need to have purpose as well. So you have to be creative when you're looking at taking care of somebody who's at the end of their life with dementia, any type of dementia, which is really brain death. So as they're moving through the process of this disease, how can you still honor them as a person and see them as a person? Because it's really hard to not do a good job when you're taking care of somebody you care about, which I get emotional about, and I'm not going to do that because we're live on Facebook, and that would be stupid. But it is important to people, and if it's considered a passion of your life, and it's considered, like, Oak Knoll's not just a job for me, it's my passion, and I expect the same thing from the staff. Did you have a question?
Well, on your list, and maybe I missed it, but a lot of times when people look at a place, they look at the food
Yeah.
and the nutrition. And yet, some people will tell me, well, as people age, like at that stage, they don't have good sense of taste and smell, and they don't care too much. So, what's your experience?
So what's my experience with food and aging is the question. I think the answer there is to provide choice and dietitian services. So if you have a dietitian available to somebody, stop looking at your watch. I found the clock late in the game, so if people have high blood pressure, high cholesterol, cardiac disease, and they want to follow a low sodium cardiac diet, we should have somebody available to talk to them about that and provide food available that's tasty and nutritious. If you have progressed, maybe you're 95 and you don't really care about salt intake anymore, we should have meatloaf and mashed potatoes and gravy available. So we have 4 dining venues at Oak Knoll. So I think if places are able to provide choice, and you can have a burger if you want, or you can have vegetarian lasagna, or you can have just steamed vegetables, as long as there's choices available. I do think it's important, though, it's a healthier generation, and I think having the dietitian available is the key. So choice and options. Yeah.
Hey, I wanted to share with you something you said about purpose and mission. And, my father spent time in nursing home, actually, Leonard Park. And during the meals is when I would visit, and it was a nursing care, and people were being fed, or, food. But sitting down and talking with them and learning about their lives, almost all of them lived amazing lives, just at the last stage of life. So it really changed my outlook about who was in the nursing home, and had a lot more respect for those individuals, which I think is something that you mentioned with purpose and mission.
Yeah, there are amazing people living in nursing homes with amazing stories to share, and they're hilarious. So if you can sit down with somebody, I mean, you have to have a good sense of humor. If you consider the losses that people have had by the time they're in a nursing home, they've lost their house, they've often lost their spouse, they may have lost some kids, a lot of their friends have died, they may or may not have their pet anymore, space, stuff is critically important. So we do a staff training with our staff, and we talk about losses, physical losses and emotional losses, and we talk about what we think that feels like and how to address that. So I really think the key is to build relationships with people. If you're taking care of Pat, then you're going to be more mindful of what Pat likes. It's all about choice. When she likes to get up, if she likes to wear her PJs to breakfast, she doesn't eat breakfast. I know this because I've gone to breakfast with her. She'll have a piece of toast and some fruit. That's not breakfast to me, but you learn those things, and that's your direct care staff. That's your dining servers. That is your CNAs. That's the lady that does laundry, that goes in every single room to deliver the laundry. It's the rec aides who are providing activities. It's those people. They have to value their position in the organization. They have to understand that you, as the leaders of the organization, value their position within the organization. They're important. We tell them that all the time, that they're the ones that are the eyes and the ears of the organization. And when they feel respected and cared about, they will respect and care about the people who live with us. And the number 1 priority has got to be the residents, and the number 2 priority has to be the staff. So that's my responsibility, is to create an environment where both those groups can thrive. Yeah.
Could you talk a little bit more about the case management?
Yeah, I don't provide case management really at Oak Knoll, but there are formal case management programs where you get a point person who can talk to you about your current state, like you're living in your home. Maybe you should get somebody in to look at your home, to evaluate if we can make some modifications so you can stay in your home later. Hopefully you're not in a 3 or 4 story house, but less levels. They can talk to the social worker with your doctor's office, talk to your doctor. They can help organize your prescriptions, pick up your meds. They just coordinate everything around you so that you don't have that burden to do yourself. Some of those programs are formalized and covered under long-term care insurance, and most of them are private pay. So you'd have to look at your insurance. Yes.
Can you speak a little about the generalized range of costs involved?
Oh, man. Sure. It's the sky's the limit, right? So Medicaid is the welfare program, and the Medicaid services, they determine what they're going to pay a provider. So I think right now it's about $200 a day for nursing home care. And the cost is probably more like $300 a day. And so places that are serving mostly Medicaid clients have a burden to make up that loss. At Oak Knoll, the private pay daily rate for the nursing home section, the health center, in a single or a double room, because we don't differentiate, is around $300 a day. Now, if you move into Oak Knoll, and you'll pay that monthly rate that you pay in your independent living apartment. So you might have a small space in your independent living apartment that is $1,800 a month. And so that cost doesn't change as you travel through the levels of care. For other places, it's going to be based on the services that you need, that fee-for-service model. So I think assisted living, and this is just a rough guess, would be between $3,000 and $5,000 a month, depending on the services that you need. And like I said, nursing home care is about $300 a day. Home care agencies are going to charge you 18 to, what did I say earlier, $18 to $40 a day or an hour, depending on the services that you need. And then they take their part, and then they give the staff the rest. So it's just variable based on what you need and the organization that you're working with. Yes?
You said that the state of Iowa has no mandated staffing ratio, but what is an appropriate staffing ratio for skilled care nursing?
So what is an appropriate staff ratio for skilled nursing? That's really hard to answer because it's going to be based on the individual needs of the resident and the layout of the place. Now, at Oak Knoll, the health center's got 3 floors, or soon will, as soon as we finish the 3rd floor. So there's going to be need for more staff just to manage 3 different places. It's really hard for me to say. I mean, it just depends on the needs, the emotional needs of the residents, the physical needs. Do they need 1 person to transfer or 2? Are they needing assistance in the dining room to eat? Do they need assistance getting to the bathroom? Yeah.
Well, is there a place, because you said it's one of the considerations that we should
Right.
take into account. So is there a place for us to know, like, if you know so much, can't answer that question?
Well, I can kind of answer the question.
You know, does that make sense? It's
Yeah.
difficult for us to know then what
So-
is appropriate when you go to a place.
Oregon is one of the states that provides minimum staffing requirements. And the state of Oregon says, see if I can remember, 1 to 8 in the daytime, 1 to 15 in the evening, and then 1 to 20 at night. And that's a CNA, that's a direct care staff. I would say that 1 to 15 on evening shift is too many. One staff person taking care of 15 residents in the evening when most people are sundowning, if they have memory issues, is too many. So 1 to 8 would be better. Yeah, that's better. 1 to 8. 1 to 6 is even better. 1 to 4, if you've got dementia, I think is what the Alzheimer's Association recommends. But check my facts on that, because, yeah.
What are the surveyors looking at when they determine whether there's enough staff or not?
So the new survey process involves a lot of talking to the residents and the families. And so you could talk to people when you're on a tour to say, how do you feel the staff is? Do you feel like they're stressed out? Does it seem like there's a lot of call-ins? Do they answer your light right away? Do you have to wait a long time for something? Is your food cold? Stuff like that, because the staffing numbers will impact the quality of the day. So if the aides are feeling rushed and they can't get to the next person fast enough because they have 15 people to take care of, they're not going to talk to you about how your night was. They're just going to get you ready and move on to the next person. So,
Well, we did a volunteer activity at a nursing home. And I went home and I thought, oh my gosh, some of the people that live there, their nails were awfully long, their hair seemed greasy, their clothes were rumpled. And so to me, that in itself told me a lot.
So she's talking about grooming and looking for those cues. Yep. So dirty nails, messed up hair, wrinkly clothes, dirty dishes. Smell is always an indicator. There's no reason that any place should smell ever. It shouldn't smell. That's an excuse. Yes, people are incontinent of urine and they're incontinent of bowel, and you can take care of that efficiently so that it doesn't smell bad.
Would it be like this was an evening one, like after dinner? Would that be more of a time people would be more in that state I just described? Or would I
The nails and the hair and the rumpled clothing sounds like a long-term problem, right? Your nails aren't going to get that way most of the time in one day. So grooming and hygiene are really important, but just the general, I mean, you can be messy and super happy. So you have to think about, you have to think about what's really important on a day-to-day basis. And if I love the CNA that's taking care of me, I'm not going to be mad at her if she doesn't get my nails cut. But I am going to be upset if I can't trust the person, if I don't ever know anybody because the turnover's so high, if nobody will listen to me. You know, part of that purpose is having value and having a voice at the table and having somebody to listen to you. And those are, I mean, I'm not saying it's not important to be clean. There are people who choose not to be clean, and they have that choice too, to be sort of unkempt. And so you don't know for sure. But I do think the personal relationships and the trust and the safety and security, when you get right down to it, are critically important.
Can I ask one more?
Sure.
But like, so after a meal, for example, there's a lot of people in wheelchairs, for example. And so if the staff park them,
Yeah.
and then they sit and wait in the hall to be delivered,
Yeah, I hate the parking. So she's talking about parking people in wheelchairs by the desk or whatever. It is a thing. It's a long-term care thing. I can't explain the parking except for safety. You know, you want them to be visible, so if they try to get up by themselves, you can see what's going on. But yeah, I've been trying to stop the parking thing for about 31 years. I don't like the parking thing.
that's common though, and it shouldn't be a judgment on
You can judge them a little, yeah. But also remember, you're only seeing a snapshot in time. So you could come in on a really bad day and come in the very next day and things are going much better. Some days, I mean, bad things happen to good places, right? There's just some days when you cannot win. And so I would comfortably say in Johnson County, we're very fortunate to have excellent long-term care system in place for our seniors. I really believe that. And I'm a member of the Johnson County Long-Term Care Quality Committee and a number of nursing homes, assisted livings. Both hospitals in Iowa City are represented, and we meet monthly. And so I think I'd like to assume that everybody is going at it for the same reason, which is to provide excellent care for people who are vulnerable and need our help. Right, so where do you go to complain if you're already in a place? So there should be, in nursing homes, there should be a name and a number posted in the nursing home for the compliance officer, or what else do they call me? I can't remember. Compliance and grievance officer, that's what it is. You should always be able to talk to the social worker, to the director of nursing. You could start with, I'm not sure what the problem would be, but you could just start with the nurse. The nurses are always there 24/7, so they can contact the administrator of the director of nursing if they need it, or the executive director. You should be able to have access to anybody within the organization. There's also an ombudsman's office, State of Iowa Ombudsman. You can contact them for concerns that aren't getting resolved if you feel like nobody's listening to you. But that's another piece of relationship building. You should never have to file a formal complaint if somebody just sits down and hears you out and doesn't make excuses and tries to fix whatever you're talking about. Yes, ma'am.
I believe there's just one subsidized assisted living facility in Johnson County. Is that, do you find that that's adequate to meet the needs of the low-income population of the county who are where they're in need of that type of assistance? I realize this may, in many circumstances, help a person to avoid nursing home, the more expensive nursing home treatment for a time.
So the question is, there's one subsidized assisted living in Johnson County, one that I know of as well. Do I think that that's, I would just make an educated guess based on the population of Johnson County and say, no, that's probably not. But I can't speak to that as an expert in any way because I'm not sure, but I bet Jeff could answer that question. But just looking around at, at the socioeconomic status of Johnson County and how many people we have, and I would say that probably one place is not enough. I was really surprised to learn that lots of the private places don't take any percentage of Medicaid people at all. I thought there would be a percentage, but no. Any other questions I can answer for you?
So, I'm sorry, I'm asking a lot of questions.
That's okay.
I was just thinking, I have a neighbor and her husband, she did find a place, but most places just wouldn't take him because he's a fall risk.
Everybody's a fall risk. I'm a fall risk. I have been hearing a lot more about avoiding risk in long-term care lately at conferences, and that includes people who are fall risk and people who have dementia. But we can't stop serving those populations because those are the majority of the people that we've chosen to serve. So honestly, there's risk involved in life. We all have risk sitting right here. And so if we stop serving people because there's risk involved, we'd go out of business. But that is a new topic of discussion at conferences. I was just shocked to learn that at the last conference. Yeah. Yeah. I'm sorry to hear that. Mm-hmm.
You mentioned financial stability. I'm a financial advisor and I do financial planning, but as far as the facilities go, and I see a lot of them being built, and some of them are non-profit, some are private, some are publicly traded for-profit. Do you have any thoughts on, comments on that, or does it really make much difference?
Well, I think if you look, I know, I'm looking at the green line on the camera. So I think if you looked in the research would show that there are better outcomes in nonprofits. I can say that because that's true. Yep. Is that okay? Yeah. And I think people are unprepared for the level of cost. I just can't recommend financial planning enough because people are shocked. They just think, well, I'll get home care in my house when I need it and it'll be fine. And it's terribly difficult to coordinate. It's expensive. People call in. So you just have to think ahead. I'm not saying don't do it. I think it's a great service, but there needs to be some planning involved. Yes. Oh, way in the back and then back to you. Is that okay? Oh, gosh.
And so him trying to maneuver to get to my mom, he got lost and they couldn't find him for 4 hours. So lo and behold, they got him in the same room with her. But the classifications between a rehab room and assisted living and whatever.
So different classifications between levels.
Any progress being made to keep couples together?
So what needs to happen in that situation is they both need to be served under the nursing home license. The skilled care is under the nursing home license, and the assisted living is under an assisted living certification. So you can't do a licensed bed in a lower level of care, but you could serve him in the higher level of care, right? Because he was in assisted living and she was in skilled. Yeah, so they should have put him in skilled from the beginning because that's a nursing home license. So they could have put him in intermediate care for the chronic care temporarily while she was receiving skilled services. Well, you can be blind and live in assisted living. It just depends on how you orient yourself to your space. You could be in your house, So it's very individualized care, but there's no mixing of the licenses, and that has nothing to do with the community and everything to do with the rules and regulations. So I promised I'd come back to you. Personal care and activities around helping another human live is complicated, and you just don't know until you're in the middle of it what you need. Yeah, I think they're getting anxious about me shutting up. So I brought some business cards. If people want my contact information, I'd be glad to give it to you. Here's Pat. Thank you.
Thank you, Kim. Very informative. Thank you so much. I wanted to let everyone know that if you go to the Johnson County Livable Community website, there is a list of nursing homes, assisted living, and independent living options throughout the Johnson County. So you would go to Johnson County Livable Communities, then there's an information tab, go to housing, and it says resident care options, and you'll see that list there. Do want to let you know that I was involved with Eve in putting that list together, and we deliberately decided not to include costs and fees because they just change at least on an annual basis, and encourage people to call and find out those costs. Also wanted to mention that that list is not an endorsement, but we wanted to provide as complete a list as we could, the facilities in Johnson County, just for residents to use as a starting point. Most importantly, and we've all talked about this, is visit. You don't need to make an appointment. You go visit these communities and facilities that you're interested in, ask lots of questions, prioritize, and listen, and really look around. And that will just serve you really very, very well as you're making those life choices. So with that, again, I want to thank Kim and Midwest One Bank for lunch. And I would say, Kim, really to use you as a resource. Any type of question that you may have about anything that we've discussed, she would be a great resource for you and help you with questions you may have and provide direction as you're trying to decide what's best for you and or your family or loved ones. Okay.